I stand to make remarks on Senate File 296 and read a statement from the administration and the 5,193 employees of St. Luke's Hospital and Mercy Medical Center in Cedar Rapids. Please keep in mind that these two organizations reflect the thoughts and the actions of many, many of our hospitals. They're just representation. Mercy Medical Center and St. Luke's Hospital are organizations whose missions and visions are put to work each day to meet the health needs of Cedar Rapids, Lynn County, and contiguous counties to diagnose, heal, comfort, and promote wellness. Mercy Medical Center and St. Luke's Hospital are committed to serving as a healing presence to the most vulnerable among us, which means the debate over whether Iowa should expand the Medicaid health insurance program comes down to a question of mission and morality. They believe caring for the least fortunate among us is simply the right thing to do. They also believe that expanding Medicaid is the right decision to protect jobs and help enhance our state's business climate. They appreciate the complexity of the Medicaid program for both the federal government and state legislators. They also understand the challenge of forecasting the financial impact of a yes or a no decision. However, as organizations who take their healing mission very seriously, they believe that expanding access to health care to an additional population of very low-income Iowans fits squarely with their mission to serve all who need medical care and reflects the priorities and values of the communities they serve. A decision against extending Medicaid coverage to more Iowans also will have a severe financial impact on the state's health care providers, potentially forcing some to eliminate jobs. Mercy and St. Luke's are already absorbing significant cuts in reimbursement under the Affordable Care Act. The hospitals and other Iowa health care providers already serve those who would benefit from Medicaid expansion when they become so sick they need care in our emergency rooms, and they absorb those costs as unreimbursed charity care. This too reflects their mission, but the growth for charity care is unsustainable and undermines their ability to support the overall demand for other community benefiting programs. More important, the emergency room is no replacement for a personal physician. Senator Sigebert, I think you said that this may put undue pressure on some of the, the 150,000 patients, undue pressure on physicians. The physicians are already seeing them, and they are not reimbursed. St. Luke's has 55,079 visits to the ER each year, and Mercy 46,075. But it is practically impossible for someone to establish a relationship with a primary care provider to create a medical home, if you will, when they are uninsured. This is why the 5,193 employees urge us to expand Medicaid coverage to as many low-income Iowans as possible. The hospitals have supported the governor's goal of making Iowa the healthiest state in the nation. They have actively supported Cedar Rapids and Marion's successful bids to become Blue Zone model communities. And they work continuously to improve the quality of care for every patient while also creating efficiencies that ensure every health care dollar is well spent. Providing high-value health care is an important part of their commitment that also reflects the expectations of the communities they serve. Accomplishing this goal, ensuring quality while also lowering health care costs through improved care management, also will fuel economic growth, a top priority for both our state and our communities. However, refusing to expand Medicaid and keeping thousands of poor Iowans uninsured physical health of our people and the economic vitality of our hospitals and our state. 5,193 employees believe they will have let thousands of struggling Iowans who are counting on their compassion which is the very heart of healthcare. They don't want to let them down. This statement was written by Tim Charles, President and CEO of Mercy Medical Center, and Ted Townsend, President and CEO of St. Luke's Hospital in Cedar Rapids, and it represents many, many of our hospitals across the state. That ends my remarks. I urge my fellow senators to vote in favor of this bill.